Hi, I'm Dr. Rich Petrowski. I'm a general dentist with over 25 years of experience, and I'm teaching you about dentistry and teeth so that you can have a very nice smile. So a common question I get is, how long does tooth whitening last? Well, the short answer is whitening will last until your teeth get stained again and get darker. So over time, the more foods that you eat and drink that make your teeth darker, coffee, tea, red wine, the quicker your teeth will stain. The more you avoid those types of foods, the longer the whitening effect will last. All right, so now that we got the short answer out of the way so you don't have to fast forward to the end of the video, let me go into the details of the whole process. So basically, tooth whitening is the act of using hydrogen peroxide, putting it on the teeth, and having the hydrogen peroxide whiten the tooth. So the hydrogen peroxide comes from the bleaching gel, and some gels actually have hydrogen peroxide as the active ingredient. Other gels have the active ingredient is something called carbamide peroxide, which will break down into hydrogen peroxide, which does the whitening. Differences between the two is that the hydrogen peroxide containing gels tend not to last as long, so those are used mostly just for a short period of time, versus the carbamide peroxide ones, the bleaching effect will last longer the longer the gel is on your teeth. So those are usually the ones you can use. You can wear overnight or a couple hours at least. In addition to those two whitening gels, there's actually two types of whitening treatments. There's the in-office whitening, which involves having your mouth propped open and gums are protected, and then the dentist will place a really high strength whitening gel on your teeth. They may or may not use a light to help activate the gel. And then the second type is take-home whitening, where clear plastic custom trays are made that fit your teeth tightly. Then you're given a kit of the gel. You put a little bit of gel onto each tooth or a little strip into the trays, and then you wear them for the recommended amount of time. If you want some more information about take-home whitening, click up here and that'll take you to my how to use whitening trays video, and where I go over the whole process of putting the gel in the trays and wearing the trays. All right, so let's get back to in-office whitening. How it works is you sit in a chair, they use some type of device to hold your lips out of the way, a cheek retractor. They put some material on your gums to cover them and protect them, and then they paint the gel on and leave it on there for a half hour, 45 minutes, whatever the length of time is. So that gel is actually very strong, pretty high concentration, and then it's removed right before you leave, and you will notice a difference from it. The downside to using that, people like it because it's a one-time thing. You go in the office, you're there for X amount of time, and then you leave. The downside to it is that that whitening effect from it. In the beginning, it's going to be very noticeable, but then over the next couple days, it'll seem like your teeth are getting darker again. And it's not that they're getting darker. What happens is during that time you're sitting in the dentist's office with your mouth open, your teeth are getting dehydrated. They're drying out. And when they dry out, they look whiter. You can even try this at home. If you can have some cotton rolls, some tissues or something, you can or wear some cheek retractors from Amazon, pop them in, hold your lips out of the way, and then just breathe through your mouth for a while, and you will notice that your teeth will get whiter at the end of it. Some of the in-office bleaching procedures use a bright light too to help activate the gel. Supposedly, it's supposed to heat it up and make it work, make it whiten better. The studies I've read seem to think that it doesn't cause much of a difference, and they think the whitening effect is mostly due to the strength of the gel that's used. Years ago, there was a company called Bright Smile that had whitening spas all over the country. I'm not even sure if they're still in business. I know they got bought out by Discus years ago, and I think Discus is still selling their products, but I'm not sure if those whitening places are available anymore or out there anymore. Take-home whitening works a little bit different. Take-home whitening, you get the clear plastic trays fit your teeth tightly. You put a little bit of gel in there, and then you wear them for the amount of time, appropriate amount of time for the appropriate gel that you use. I usually offer patients two options. I have one type of gel that takes about a half an hour. So people will put that gel into the trays and wear for a half an hour once a day. I also use a lower strength gel too, that for people whose teeth may be more sensitive or they need to bleach longer. For instance, people who've had tetracycline staining as a kid. So for that gel, you put it in, you wear the trays overnight, and then you take them out in the morning. But basically, how well that works, it comes down to two things. It comes down to the strength of the gel and how long you wear it. So with the stronger gels, you can get away with wearing them for a shorter period of time. And then for the weaker gels, you need to wear them for a longer period of time. All right, so now that you've done the initial whitening period, so it usually takes about 2 weeks, most people, for the average person. Generally, the whiter your teeth are to begin with, the less time you have to do it. If you have very darkly stained teeth, then it could take you 3-4 weeks of whitening. Some people, again, with the tetracycline staining, that could take months of whitening every day to get rid of some of that staining. So now that your teeth are whitened, what happens? Well, after the take-home stuff, you're not going to see that bounce back because your teeth never got dehydrated. They stayed moist the rest of the day. After you remove the trays, the saliva in your mouth, water you drink, keeps them nicely hydrated. So you don't get that bounce back effect. But from there on in, every time you eat or drink something, again, coffee, tea, red wine, blueberries, rule of thumb is anything that'll stain a white shirt will stain your teeth. Not to the same effect as a white shirt gets stained, but you will pick up staining going forward. So one way to avoid that is to hold on to those trays and then just do a touch-up once a month, 1 or 2 days a month. Just wear them again for the prescribed period of time. So if you're using the daytime gel, half an hour once a month should keep your teeth nice and pearly white. Worst case, if you don't do any touch-ups and after a year or two you notice your teeth are not looking as white as they used to be, you can always whiten them again. I mean, it's not going to cause any damage. Usually, downside to whitening is you get some sensitivity while you're doing it that goes away once you stop. I like to explain to people that the maintenance phase of whitening is kind of like as if you're somebody that gets their hair dyed. So after you get your hair dyed, few weeks, a month go by, it's not that the color is gone from your hair, it's just all of a sudden the roots show and you have to go back in and get it touched up. And so it's a maintenance process. You always have to, once a month, take care of that, otherwise it's going to be a noticeable thing. Same thing with whitening. It's just a maintenance. You got to do it once a month just to kind of maintain it. So I hope that explains that once you whiten them, they should stay white unless you did the in-office. A lot of times too, when I used to do the in-office bleaching, I would have people follow up with the take-home as well, just so that they had it to kind of maintain it, or if the one in-office visit wasn't enough for them, they could do it do it for a few more days afterwards. I got to the point though where more people were complaining that they weren't getting great results with just the in-office. I discontinued doing the in-office visits because they were getting a lot of sensitivity from that really strong gel. It was easier to do the take-home whitening, and I think they got better results in the end. So thank you guys so much for watching. I hope you enjoyed this video. I'd really appreciate if you're not a subscriber to click that subscribe button. It really helps me out. It doesn't cost you anything. And also, if you can give me a like on this video too, I would really appreciate that as well, because it really helps out with YouTube's algorithm. The magic algorithm. All right, thank you so much. See you next time.